And welcome back to Your Health Matters. I'm Lisa Brown. The increasing number of obese children and youth throughout the United States has led policymakers to rank it as a critical public health threat. Since the 1970s, the prevalence or percentage of obesity has more than doubled for preschool children ages 2 to 5 years and adolescents aged 12 to 19 years, and it has more than tripled for children ages 6 to 11 years. My guests today are from the Council for Child and Adolescents with Chronic Health Conditions. They're a nonprofit organization. Denise Brewitt is the executive director. Also joining us, Sue Avard. She is a member of the council and is a registered nurse. Both women involved in advocating for children and better health for children. Welcome back.
Thank you.
You know, we can point fingers and we can blame the parents and we can blame genetics, really, which really is where it begins for the most part. But instead of playing the name game, what can we do now to say, okay, where are the areas that we can make some changes and make some positive differences in the lives of children? And I think that obviously the answer for me would be in the school system, whether it's educating the children or feeding them in the school lunch program. So take it from there.
Exactly.
Take it from me and take it from there.
Well, I mean, and I think that's where we're at as far as in New Hampshire, that I think everyone knows that this is a reality and a problem here for our youth here in New Hampshire. And what can we do to start to change it to improve the situation? Because obesity is something you can reverse. I mean, you can do things to improve your lifestyle. When we're talking about the schools, physical education programs were established 40 years ago in a response to a presidential commission concerned about the fitness of the nation's youth. So this really isn't a new problem.
Right.
And today, the standards-based reform policies kind of have shifted to a few core subject areas: math, reading,
Right.
And so leaving that physical health component, as I just discussed before the break, it's kind of fallen behind.
I think we used to have nutrition as part of the education, just proper nutrition, maybe 20 minutes a day in that.
Right. Well, I think unfortunately what happens, I think you get the nutrition in the higher grades, but honestly, it needs to start at a younger age. The nutrition, and children need to learn to know about making the good choices. Yes, they should be getting that at home as well, but it's always helpful if you're getting it at school and you're having more time with it.
So what is being done when it comes to schools? I mean, is the focus for your organization and as legislative influences of proper legislation, is the focus now on getting proper nutrition in the school lunch program, or is it in educating?
Well, it's twofold. It's really in both of those areas. We certainly are supporting schools that are trying to improve their lunch programs. I think that all parents want their children to have better choices instead of just hot dogs and French fries at lunch.
So where's the bottleneck? What's the problem? Why isn't it just that, okay, we're going to have better lunches? What's the problem here?
Well, unfortunately, many schools receive support,
Right.
government support.
Right.
And so it's kind of putting the pressure on the government to say, we need to subsidize these lunches with better choices, even though sometimes the choices that are not the most nutritious, unfortunately, are also the cheapest. So we need to focus on getting away from that thinking process and focus on good, healthy choices for our kids. It's worth the cost.
But we've heard about that. I mean, we've heard about some school systems where they're taking away the soda machines and they're taking away some of the snack bar stuff and vending machines and things like that. Why is it that it seems so difficult? Why is everybody stuck when it comes to this?
Well, because it's easy. I mean, it's easy. I can speak as a parent when you have kids involved in after school activities and you're running around and you have all, it's really easy to buzz through McDonald's and get a quick dinner, at the fast food restaurant, or to grab a Lunchable at the grocery store to give your child, because it's easy. I mean, we're in a very fast-paced society, and sometimes to make a healthy choice it requires a little thought process. It requires you going to the grocery store a few more times to get those fresh vegetables and fruit, so that they're sitting on the counter, so that kids have easy access to those to take to school. Take an apple to school as opposed to a bag of chips.
What? Right. And I understand that. I'm just wondering, I want to go back. Why can't the schools put nutrition first when it comes to the school lunch menus? Why is that seem to be such a hard thing?
I think it's getting parents to advocate for it. It's getting parents to use their voice and put the pressure on the school systems that this needs to be a priority.
And I think it's also the cost of it. Let's face it. I mean, especially today with everything that we're going through in the economy, fruits and vegetables, they are more expensive. It is easier to do something.
Macaroni and cheese.
And you can feed a lot of people
right
with that.
I mean, it seems like it's a vicious cycle, and there's always the problem is always has to do with money. But I think that the parents do have to take more of an advocacy role when it comes to proper nutrition for their kids. And unfortunately, there are too many parents that, or too many kids, through no fault of their own, are on assisted lunches. And so, when you're getting something for a little bit less, who's going to complain? So I can
something is better than nothing. I mean, and I think that,
we've in preparing for your visit today, there are some interesting initiatives taking place, though, in some school classrooms, and one of the initiatives that I read about was the concept of a chairless classroom. What is that?
Well, it's basically designed to not only promote effective teaching, but it's a design that also promotes good health so that kids are moving around the classroom. They're not just sitting sedentary in their chairs all day long. They're up and about, and they're going from different stations, using podium-like furnitures in the classroom, so they're actually not even sitting in chairs. They're constantly in motion.
Now, where are they doing this?
They're actually doing it out on the West Coast. Surprise.
But of course they are.
Exactly, which I think everyone knows that New Hampshire, I think New Hampshire's a long way from that.
Well, I know a lot of kids that could probably use a class, a chairless classroom because they're up and about, and these kids are, sugar high, and they're running around the room.
Right.
And it's hard to sit still. What are we doing in New Hampshire?
In New Hampshire, I think that a lot of teachers are now realizing that this is an issue to get kids up and moving about in the classroom. So they're doing more things with having stations and getting them up and moving, getting them up and stretching and walking, and realizing even to improve their learning, to be honest with you, to get their blood circulating a little bit in that, during that process of a school day. If they're not, the older kids aren't out at recess, so they don't have the opportunity to run around, but to get kids up and moving about.
What are some of the causes of childhood obesity? I referred to it, earlier that a lot of it is genetics, and so, but that's not the kiss of death.
No, it's certainly not the kiss. It's sedentary lifestyle and making poor nutrition choices.
One thing that I thought was interesting was the amount of sleep that a child gets. As a nurse, Sue, tell me a little bit about how just getting kids to have the proper sleep might actually get them up and out and physically better.
I definitely agree with that. I think children need to have their 8 hours to 9 hours of sleep a night. There was a study out of the University of Michigan that showed for every additional hour per night a third grader spends sleeping, it reduces their risk of being obese in the 6th grade. Even though they're at the normal weight at this 3rd grade level, the longer they go through the years with less sleep, the more likely they are to be overweight. And I guess this relates to the hormones that are regulated, that regulate your appetite. They're disturbed because you have an inappropriate amount of sleep.